Thank you, Mr. Chair and members of the committee. Thank you for the time to present AB 1364, the California Nursing Initiative, which will expand the nursing workforce in California. I would also like to thank the committee staff who helped improve the bill, and I accept the proposed amendments as put forth in the analysis, so thank you. As I'm sure many of you are aware, California is currently experiencing a shortage of nurses throughout the state. According to a report by Health Impact, 85% of hospitals in California reported demand for nurses being greater than the supply. The same report highlights that California has historically been behind the national average of nurses per capita. This high demand of nurses is likely to be further intensified by the decreasing number of uninsured people in California as a result of expanding access to healthcare, as well as the high growth rate of senior population. We all know it as a silver tsunami. The peer-reviewed journal, American College of Medical Quality, recently reported the nursing shortage is expected to continue to grow by 2030. The report estimates a shortage of over 140,000 nurses. At the same time of high demand for nurses and a projected nursing workforce disparity, the Board of Registered Nursing has extremely limited enrollment on nursing programs in California. As a result, students seeking enrollment in the nursing program are forced to wait for unpredictable amounts of time on wait lists, or programs are forced to deny the enrollment altogether. Not only does this discourage students from even applying to nursing schools, it encourages students to look outside of California for other opportunities. These are just some of the reasons why it is so critical to act now and ensure California is taking every step to expand the nursing workforce. And AB 1364 is a step in that direction. This bill will exempt BRN approved nursing programs that maintain a high pass rate on the state licensing exam and are programs accredited by a nursing accrediting agency from additional BRN regulations and oversight, including enrollment caps and faculty approval, the ability to use up to 50% of simulation-based learning, and the partnerships between nursing programs and clinical facilities. With me today are representatives from nursing programs to further highlight the importance of this bill and provide additional expertise to address any questions or comments. We have Nicole Hesemby, Robin Nelson, and Dr. Jan Jones-Schneck, and George Miller.
Thank you very much. No more than 3 minutes in total for your testimony and support. Please feel free to present whenever you're ready.
Good afternoon. Thank you, Chairman Lowe, Vice Chairman Bro, and members of the committee. I'm Dr. Jan Jones-Shank, Dean and Academic Vice President of the College of Health Professions at Western Governors University, and I'm here to testify in support of AB 1364. Western Governors University, or WGU, was established in 1997 by 19 U.S. governors with a mission to expand access to high-quality, affordable higher education. WGU is regionally accredited, nonprofit university serving stranded learners, working adults with some education but no degree. We offer bachelor's and master's degrees in business, IT, teaching, and healthcare. In 2009, the state of California and 3 large California healthcare employers and the Robert Wood Johnson Foundation partnered with WGU to develop a pre-licensure Bachelor of Science in Nursing degree here in California in an effort to reduce the state's growing nursing shortage. Over this past decade, we've graduated over 250 BSN nurses, far below our capacity due to regulatory constraints. Last year, for example, WGU was only permitted to admit 40 new students, just 2% of all qualified applicants. Of our pre-licensure graduates, 61% are from ethnically diverse populations, 44% are men, and the average age is 35 years old. Our first-time licensing exam pass rates, the NCLEX exam in California, is 97%, as compared with the national average for like programs at 92%. Total tuition and fees for our pre-licensure BSN program is less than $30,000 in total. WGU's ability to fulfill our mission, serve California's stranded learners, and alleviate the state's nursing shortage has been drastically hindered due to the duplicative, onerous, and even punitive regulatory constraints around enrollment, faculty, and clinical site approval by the BRN.
1 minute left.
In closing, WGU would like to ask for your aye vote for this bill.
Chairman Lowe and members of the committee, my name is Nicole Hasabi. I am a graduating senior at West Coast University, and I thank you for the opportunity today to testify in support of AB 1364. My family immigrated from Afghanistan, and I was 10 years old when I became a United States citizen. The day I became an American was an incredible day, yet at 10 years old, I was too young to have truly understood the gravity of that moment or everything my parents had sacrificed in order to grant me full freedom and opportunity. As years passed, I began to understand that being an American meant that my race, my gender, my religion, my socioeconomic status, none of these things should place a barrier over my ability to achieve success. Yet these fundamental truths were challenged when I began pursuing my dream of becoming a registered nurse. I simultaneously held 3 separate minimum wage jobs while trying my best to navigate the higher education system. Local public colleges were severely impacted, and for years I sat on waiting lists or offered irrelevant courses in order to stay registered as a student.
Thank
It
you very
became
much.
clear.
Thank you very much. That concludes the 3 minutes of testimony in support. Additional witnesses wishing to speak in support, name and affiliation if you wish to do so.
Matt Back, representing CAPS, in strong support.
Thank you very much. Any additional witnesses in support? Seeing no additional witnesses in support, now I'd like to call